What anatomical involvement means for lung cancer and breathing? Imagine your lungs as a complex system of airways, tissue, and surrounding structures working together to help you breathe smoothly. When lung cancer develops, it can affect these parts in different ways, and understanding this is key to grasping how it impacts breathing. Anatomical involvement refers to how much and which specific areas within the lungs and nearby structures the cancer has affected. It could be confined to a small part of the lung, or it might spread to vital areas like the main airways, lung tissue, lymph nodes, or even the chest wall and diaphragm. The extent of this spread influences how well you can breathe and what symptoms you might experience. The lungs are made up of airways such as the trachea and bronchi, which carry air in and out. The lung tissue itself, called the parenchyma, is where oxygen and carbon dioxide are exchanged. When lung cancer involves these airways, it can cause narrowing or blockages, leading to symptoms like coughing, wheezing, or shortness of breath. If the cancer invades the lung tissue, it can cause inflammation or collapse of parts of the lung, which reduces the amount of oxygen reaching your blood. This can make breathing feel more difficult and cause fatigue. Lymph nodes near the lungs are part of your immune system, and when cancer spreads to these nodes, it often indicates more advanced disease. Enlarged or affected lymph nodes can press on airways or blood vessels, further impairing breathing. If the tumor extends beyond the lung into the chest wall or diaphragm, it can cause chest pain and restrict the natural movement of your chest during breathing. This can make deep breaths painful or difficult. Treatments like radiation or chemotherapy can sometimes cause side effects such as inflammation or scarring in the lungs, which may lead to ongoing breathing problems. The location and spread of the tumor are also important for staging the disease, which helps doctors decide on the best treatment plan. For example, a tumor blocking the main bronchus or causing lung collapse is usually more advanced and may requiring more aggressive treatment. Symptoms that reflected anatomical involvement include persistent cough, shortness of breath, chest pain that worsens with breathing or coughing, wheezing, and recurrent lung infections. These symptoms happen because the tumor disrupts the normal structure and function of the lungs. To get a clear picture of how far the cancer has spread, doctors use imaging tests like CORT scans. These scans show the size of the tumor, whether it involves nearby lymph nodes, or if it has invaded other structures. In summary, when lung cancer involves specific parts of the lung and surrounding areas, it can significantly affect breathing. Obstruction of airways, damage to lung tissue, and invasion into nearby structures all contribute to breathing difficulties. Recognizing the extent of this involvement helps doctors determine the stage of the disease, predict outcomes, and plan treatments that aim to control the tumor while preserving as much lung function as possible. If you or someone you know is facing lung cancer, consulting healthcare professionals for personalized assessment and care is essential.